name is Shayla Reber, and this is my clinical case presentation for Nursing 5830. Today we are presenting with LD. She's a 12-year-old English-speaking Caucasian female presenting in the clinic today with her mother. LD lives at home with her mother and two younger brothers, but stays with her father in a neighboring town every other weekend. LD's mother made the appointment for the patient to be seen in the clinic today due to her runny nose and complaints of a sore and itchy throat since she returned from her father's house 1 week ago. LD's mother states that she sniffles nonstop and can barely speak in the mornings when she first gets her up for school. It is causing her mother great distress because she is a single mom working 2 jobs and had to call in to work today because LD stayed home from school. LD is a good historian and states she is never sick, has never had any surgeries or procedures other than tubes placed in her ears when she was a toddler, has not been around anyone ill that she knows of, and is not sure what brought this on, but it just won't seem to stop. The patient's father carries her on his Blue Cross insurance through his employer, and the patient's PCP is Dr. Wallace, whom she is here to see today. Her chief complaint is, my nose won't stop running and my eyes and throat itch like crazy. For the HPI, LD is a pleasant 12-year-old Caucasian female who presented to the clinic with complaints of runny nose, itchy eyes, and sore itchy throat times 1 week. She states the symptoms started shortly after she arrived to her father's house 1 week ago today and have not stopped since. She states the symptoms make it difficult for her to concentrate at school during class because of the constant sniffling, and states that she thinks it bothers classmates around her too, which she claims is embarrassing. She is not able to identify any aggravating factors, but states the hard candy her mother has been giving her helps her throat for a little while. LD's mother identifies the hard candy as glutinous throat lozenges. LD states it is sometimes hard to swallow with her throat soreness and describes her nasal discharge as thin and clear. She states that her throat hurts the worst when she first wakes up, but her nose and eyes are the same and constant throughout the day. She rates her throat pain as a 6 out of 10 at its worst and a 4 out of 10 at best, and rates the itchiness of her eyes and nose at a 5 out of 10. Other than the throat candy, LD states that she has not taken anything else for her symptoms and denies any daily prescription or over-the-counter medications or herbal remedies. She denies cough, fever, chills, and night sweats, and denies changes in hearing and or vision or changes in taste. LD's mother states that LD has never been diagnosed with seasonal allergies, states that no one in either household smokes, and that there are no inside pets, which triggers LD to interject that her father's girlfriend, in fact, just got a new inside cat. Social history, LD is not aware of any environmental exposures or irritants at school or either home. States that she has never had issues with animals before, but her mother states that they've never had inside pets due to her own allergies with pet dander. LD's mother states that she washes all the bedding weekly, but states that LD does have a stuffed bunny that her late grandmother gifted her that the patient sleeps with every night and brings to and from her father's house, which has not been washed. LD denies use of tobacco, alcohol, or any illicit drug use. States that she has many friends and considers herself to be popular at school. She attends a local public school, states that she's always on the honor roll, and states that although she does not exercise, she plays recreational soccer and softball and considers herself to be active. LD's mother states that the patient has never been one to sit inside and watch TV on a pretty day. Patient states that she does not have any medication, food, or environmental allergies that she is aware of and is up to date on her immunizations. Patient's mother states that she has not had her first menstrual cycle yet, but that she thinks that it will be coming any day due to the patient's breast budding and other signs of sexual maturation. Patient is not, nor has she ever been sexually active. Patient states that she was recently saved at her local Baptist church and is active in the youth groups there. For subjective review of symptoms, generally the patient believes she is healthy and states that she's never sick, denies changes in weight, fatigue, weakness, fever, chills, or night sweats. Head denies history of head trauma or headaches. Eyes, she states that she's never had any trouble with vision, never had to wear glasses or contacts, and states that she always gets a perfect score during her eye checks at school. She states her eyes have never watered before this past week, other than when she's helping her mother chop onions, and can't think of any other time that her eyes have itched. For ears, she denies any hearing changes or loss, tinnitus, discharge, or earaches. Her mother states LD has not had an ear infection since she got her tubes 9 years ago. For nose and sinuses, denies rhinorrhea prior to this past week, denies known allergies, stuffiness, epistaxis, nasal and or sinus pressure, but states she does sneeze in the mornings when she first wakes up, but not throughout the day. For mouth and throat, denies mouth sores and bleeding gums, denies swollen lymph nodes, states she does not share food or drink with others. She states that her voice is a little hoarse in the mornings, but gets better after drinking water. Cannot identify any prior throat infections or throat soreness prior to this past week. For dermatologic, she denies any changes in skin lesions or rashes. For respiratory, she denies cough, shortness of breath or wheezing, hemoptysis, bronchitis or pneumonia, asthma, and tuberculosis. She states she's never had a chest x-ray, or any x-ray for that matter. For endocrine, she denies intolerance to heat or cold, polydipsia or polyphagia. For hematologic, immunologic, she denies abnormal bleeding or bruising. For psychiatric and developmental, she's recently had trouble focusing at school with current symptoms and feels embarrassed about her persistent sniffling, but otherwise no history of depression or anxiety. She states her favorite subjects are math and science, and that she usually picks up on school lessons quickly, has never had a problem focusing before. For objective, her vital signs are blood pressure 104/73, heart rate of 79, respiratory rate of 16, her temperature was 98.2. She is 4'11" and 94 pounds with a BMI of 19, which is right in the normal range. For general, she's a pleasant, confident 12-year-old girl. Caucasian, no acute distress. She is awake and alert, oriented ×3, well-groomed and well-nourished, falling right in the 50th percentile for height and weight, with appropriate for age behavior. She was cooperative and kept eye contact and did most of the talking throughout the interview and the exam. For head, she's normocephalic, atraumatic, with even hair distribution over scalp with no visible or palpable masses present. For skin, warm and dry with normal turgor, no rashes or lesions noted. For eyes, bilateral eyes with even hair distribution and increased tearing, mild stringy mucoid type discharge with reddened sclera and prominent superficial conjunctival blood vessels noted, with mild cobblestoning to conjunctiva present bilaterally. No ptosis or lesions noted, extraocular movements intact bilaterally, pearla, normal convergence. The bilateral fundoscopic exam revealed sharp disc margins and no hemorrhages, and she had bilateral 20/20 vision. For ears, her external ear structures were equal bilaterally with no inflammation. Bilateral tympanic membranes are pearly gray, intact with positive light reflex bilaterally. And although she said she had PE tubes placed as a toddler, they were no longer present. Ryan Weaver and whisper tests were normal bilaterally. For nose, septum is midline, boggy pale nasal mucosa noted bilaterally. No pain with palpation of sinuses, thin, clear nasal discharge present bilaterally, no foreign objects noted. For mouth and throat, pink and moist mucous membranes with appropriate dental hygiene noted, no wounds visualized. Her uvula and tongue were midline. Tonsils are rated at a 1+, no inflammation noted. Posterior pharynx reddened with mild inflammation and cobblestoning present. Clear postnasal drainage noted. For neuro, appropriate sensation of pain and touch and no numbness or tingling identified. For neck, absent infraclavicular or cervical lymphadenopathy. Thyroid is smooth without nodules or goiter. Even skin color distribution. 2+ carotid pulses bilaterally with no thrills on palpation or bruits on auscultation. And there were no clicks, jaw with no clicks, full range of motion noted. For respirations, were even and unlabored with symmetric chest rise, clear breath sounds auscultated throughout all lung fields, no wheezes, crackles, rhonchi, or cough noted, and her AP diameter was approximately 2:1, which is normal. No labs were done at this time. And the main stressors identified in LD scenario were throat pain, nasal discharge, eye itchiness, and finances. So Fawcett and Newman define a flexible line of defense as the normal line of that protects the normal line of defense, which is the normal healthy state of the individual. So the lines of resistance come into play when the stressor or stressors penetrate the normal line of defense, resulting in symptoms, for example, a fever in response to infection. The degree of reaction is the amount of system instability or alteration from that healthy state that the individual is normally in. So LD symptoms can impact all areas, including physiologically, psychologically, socioculturally, developmentally, and spiritually. Her symptoms are affecting her intrapersonally as she is physically experiencing persistent pain and itching, which is interfering with her normal daily activities. She had to miss school today. She's interpersonally affecting her interaction with family and friends and classmates. She feels embarrassed about persistent symptoms, affects her ability to focus during class lessons, potentially slowing down her developmental learning, and her inability to focus could also affect her concentration in church. She could also feel guilty about her mom having to miss work. For extra-personal, mainly financial stressors of the doctor's visits and prescription or over-the-counter remedies, the mother did have to take off work today to bring her in. After careful review of the history and physical, diagnoses are allergic rhinitis and allergic conjunctivitis. Uphold and Graham, 2013, states that the eye is the most common target organ of IgE or mast cell hypersensitivity reactions, and direct exposure to environmental allergens result in ocular signs and symptoms of allergic conjunctivitis, including the hallmark symptom of itching accompanied by tearing, nasal congestion, and mucoid eye discharge. The diagnostic criteria include history and physical, and Uphold and Graham state that culture of ocular discharge is not usually recommended for mild conjunctivitis with a suspected viral, bacterial, or allergic origin unless it's unresponsive to the initial treatment. Allergic rhinitis, according to Uphold and Graham, is an IgE-mediated inflammatory disease as well, involving the nasal mucosa membranes. Presenting symptoms include onset between the age of 10 and 20 years old, most common, nasal obstruction, nasal pain, postnasal drip, coughing, sore throat, itching, and puffiness of eyes may occur. Pale, bulgy nasal mucosa with thin secretions, and cobblestone appearance of the conjunctiva. Diagnostic criteria include the HMP, and Uphold and Graham state that diagnosis is usually made from the HMP alone and that no tests are required. The effective long-term management may prevent or reduce general respiratory tract inflammation and lower airway hyperreactivity, thereby decreasing incidence and worsening of asthma and other diseases. However, Uphold and Graham state that allergen avoidance is the most effective form of treatment. So the plan here is to encourage LD to continue to monitor her symptoms and journal episodes of allergic symptoms with any associated factors to bring to her next visit, and to recommend washing the stuffed bunny that she sleeps with as soon as possible. Encourage LD's mother to talk to LD's father about the inside cat and importance for LD to avoid close contact. We'll also initiate a trial of Zyrtec 5 milligrams PO daily that she can take at bedtime. And we'll educate her on the avoidance of triggers and known allergens, and to avoid close contact with the cat, and to avoid allowing the cat around her personal belongings, bedding, etc. Encourage increased fluid intake, especially water, and frequent hand washing, especially with her itchy eye, so that it doesn't turn into any kind of bacterial infection. Educate LD and her mother on when to seek immediate care, including severe uncontrollable epistaxis, unusual headaches, or fever. We'll also recommend a return follow-up in 2 weeks.
Okay, so all I wanted to add was that it was Uphold and Graham's Clinical Guidelines in Family Practice in 2013 that I used as my major reference. And in there, they state that in the absence of red flags like eye pain, photophobia, yellow-green purulent eye discharge, or a severe foreign body sensation, that both of these conditions can be treated in a primary care setting. So being treated by a nurse practitioner is completely appropriate. For allergic conjunctivitis, they did recommend that the most common symptom, like itching, can be relieved by an oral antihistamine, preferably a second-generation drug that is relatively non-sedating. And Uphold and Graham recommended Zyrtec 5 to 10 milligrams once daily. So we started out with the lowest dose. For allergic rhinitis, they recommended actually a first-generation antihistamine, which would be like your Benadryl. But since LD is in the school age, I felt that a second-generation non-sedating oral antihistamine was completely appropriate. As for her lines of resistance would be her symptoms personally, which would be the itchy, watery eyes, the sore throat, and the persistent runny nose. So her follow-up would be to make sure that these symptoms have improved or gone away completely, and then she has returned to her normal line of defense. Thank you for your time. As far as my other reference that I used in this clinical case presentation would be Fawcett and Newman's 2011 Newman Systems Model. Thank you.